New Omicron subvariant XBB.1.5, known as Kraken, has been detected in several provinces across the country in recent weeks. And experts are now warning that this is the most transmissible variant so far. To talk about how concerning this new variant is, I'm joined live now by infectious diseases physician Dr. Isaac Bogoch. Happy New Year. Thank you for joining us once again.
Good morning. Happy New Year. Thanks for having me on.
No problem. Now, to start with this new variant, Kraken, being the most transmissible at this point, how concerning is it? And is there any indication that it's causing more severe illness?
Yeah, so XBB 1.5 was identified, has been identified in over 30 countries worldwide. Of course, it's here in Canada. It looks like it has some competitive advantage. It seems to be growing, especially in the United States. In other parts of the world, it doesn't seem to be expanding as quickly, but it certainly is present and expanding. And again, I think at the end of the day, at an individual level, nothing changes. Nothing changes at all. We know that the vaccines continue to provide fantastic protection against more severe manifestations of the virus, like hospitalization and death. We know that if we put a mask on in crowded indoor settings where the vast majority of COVID is transmitted, we can reduce our risk of getting a COVID-19 infection. And if it's hard to say a silver lining, but if there is a silver lining, in parts of the United States that had the highest burden of this particular sublineage, they've already started to see a drop in their wastewater COVID signals and a drop in their hospitalization signals. So there are positive signs. Having said that, we always have to take it seriously. And I think people should take steps to protect themselves against COVID, regardless of what sublineages are circulating.
Now, speaking of wastewater signals, here in Ontario, some of the latest numbers have been put out. And as expected, throughout the holidays, it looks like there was an uptick in COVID cases, but that appears to be going down now. Is that correct?
Yeah. Ontario released some of their data yesterday. And, this is the same pattern that was seen exactly 1 year ago and exactly 2 years ago. And you know what? We don't have a crystal ball, but it might be seen this time next year as well. Like, there certainly is a seasonal component to this virus. Of course, we've had out of season, for lack of a better word, waves as well. So it doesn't have to perfectly align with seasons. But yeah, I mean, certainly there is a decline in the wastewater signal. That's clearly a positive sign. Of course, like, that doesn't mean there's no COVID out there. It means that at least the community burden is likely declining. And, if we look back at the last couple of years, there have also been spring waves of COVID-19. And again, it's just important to recognize that this, even though we might not be talking about it as much, it's still out there. It does disproportionately impact older populations and vulnerable populations. And again, we can take steps to reduce our risk of getting this infection and having severe manifestations from this virus. So it's important that we don't put our head in the sand and ignore it. We should pay attention that it's still out there, and certainly it can cause infections and it can cause harm.
Yeah, and hospitalization as well. The province putting out new numbers when it comes to hospitalizations and ICU numbers. And you are seeing a large increase over the last few weeks, a doubling, sometimes tripling as well, of hospitalizations that are due to COVID.
Yeah, I mean, this is tricky to parse out. Like, as someone who works in the hospital and admits people to hospital all the time, sometimes people come in and COVID absolutely is the cause of them coming into hospital. Sometimes we bring people into hospital for reasons completely unrelated, and they test positive for COVID, and that positive test might be from weeks ago, and the reason they're coming into hospital is completely unrelated to COVID. And again, I know sometimes things get politicized and polarized, and this is one of those topics, but it's just fact. That's just what happens. But safe it to say, the people who are coming into hospital because of COVID, either it's causing their illness or it's exacerbating their underlying medical condition, those individuals typically tend to be on the older end of the spectrum. They're almost, not exclusively, but almost exclusively over the age of 60, and the rates go up really much higher for those over the age of 80. That's why it's just really important for people who are on the older end of the spectrum to receive that booster vaccine dose.
All right. And when it comes to children, is there any indication that this new variant is any more permissible for children and getting this as well, especially now that we're starting to see this decline in emergency rooms being crowded when it comes to children's hospitals? People are hoping that this lasts and we don't see another increase in that.
Absolutely. Now, of course, anyone of any age can get COVID. Anyone of any age can transmit COVID. It's important to recognize that. When you look at who is sick enough with COVID to end up in emergency departments and hospitals, yes, of course, kids can get sick and end up in an emergency department and in a hospital. But the rates of this, the risk of this is so much lower versus older adults, especially compared to the highest risk older adults, those people who are over the age of 60. So, of course, it can happen. It does happen, but not nearly to the same extent as older adults. And in fact, you look at something like influenza. Influenza can be pretty serious. RSV, respiratory syncytial virus, can also be very serious in children as well, and that was also driving a lot of those hospital admissions not that long ago. Thankfully, those are in decline.
Yeah, we hope it stays that way for sure. All right, thank you so much, Isaac Bogoch, for joining us this morning. Appreciate it.
My pleasure.